This morning, a cruise ship returning to California from Hawaii is being held off the coast of San Francisco.
We have a number of passengers and crew members that have developed symptoms on this cruise ship.
It comes amid suspected links to 2 coronavirus cases, one of them fatal. Both of those passengers were on that same ship, the Grand Princess, but during a previous cruise. Now, 11 passengers and 10 crew members are exhibiting symptoms on board.
That number may significantly understate. It may indeed be abundance of caution because we don't have the benefit of how they are self-identifying.
Earlier, a health screener at LAX Airport tested positive for the virus. It's not clear if he or she may have exposed others. On the East Coast, 1,000 people have now been asked to self-quarantine in New York, including hundreds who are potentially exposed at a synagogue last month.
It's inevitable that it will continue to spread.
While experts maintain the risk of contracting the coronavirus is low, many are skipping travel plans. With business plummeting, United Airlines slashing domestic flights by 10% next month and scaling back its international trips by 20%. JetBlue also cutting flights. President Trump met with airline chiefs on Wednesday at the White House to discuss the crisis, while on Capitol Hill, health experts were discussing the risks of flying.
For the airplane, which our colleagues were just asking about, how long can the virus material last on a surface?
The virus can last hours to a day.
Up to a whole day?
Yes, ma'am.
Later today, Vice President Pence will travel to Washington State, where 10 people have died.
We understand the anxiety this has created in the full community, and we're going to be going out just to make sure that they have everything they need and all the support they need.
Officials in King County, which includes Seattle, are recommending but not mandating that residents at higher risk stay home and avoid crowds. They're also urging businesses to find ways to allow employees to work remotely. Amazon responding by telling its Seattle staff to work at home for the rest of the month. Tech giant Microsoft taking similar steps with its employees in both Seattle and San Francisco. While one of Seattle's most iconic companies, Starbucks, doing its part to prevent the spread of the virus, temporarily suspending the use of personal cups at its stores nationwide. Also this morning, word that the outbreak is forcing the first major delay from Hollywood. The worldwide rollout of the latest James Bond movie pushed back from April until November.
It's extraordinary to think about a major metropolitan area like the Seattle area encouraging folks to stay home and work there if they can. What should you take into account, and what's the government taking into account in whether to do an order or make a decision like that?
I think right now this is really also coming down to the company level, right? Employer level. If they're telling their employees to stay home, and a lot of factors go into that. Is anybody sick, for example? What kind of close contact has that employee had with others? How much travel history and exposure might there be from people maybe coming in and out of the company and having traveled domestically or abroad? And then to what extent is the proximity of the office location, Seattle, San Francisco, whatever the case may be, is that in and of itself a risk factor? And some companies now in the Seattle area have decided, in fact, it is.
Hey, Tom, really quickly here, what are, for folks who are watching and listening who are rightfully worried, what are some of the most important things that people should be doing to avoid getting the virus altogether?
And, you know, I got to say, my email has blown up from even colleagues over the last few days asking to reiterate this. So let's go through this one more time. It bears repeating. Now, the number one thing to avoid getting sick is simply to wash your hands regularly. They say wash your hands for a good 20 seconds or so. Avoid touching your face. You know, we all have a tendency to want to scratch our face or whatever the case may be. But as soon as you do that, if you've got a contaminant on your hand, you can spread it to your eyes or your nose or your mouth. So that's a problem. Avoid close contact with people who might be sick. And then, of course, if you yourself are sick, then try to stay home. And, you know, there's also now this recommendation, maybe avoid shaking hands and hugs and kisses. That was a recommendation yesterday from health authorities on the West Coast. And try to stay away from people, 6 feet away from people, if you think that they may be sick as well. Just common sense is really where we are right now.
All right. Tom Costello from Reagan National. Tom, thanks, bud.